Hey to all my subscribers out there, Paulie T for KoldTurkey. Thanks for joining me today. I'm just going to look at this short video about heroin option and treatments for heroin addiction to share with some of my subscribers. I've had a lot of mail asking about the best way to treat heroin addiction. Just the simplest of questions. What is the best way? My son is addicted to heroin. What's the best thing for him to get treatment? Should it be suboxone, methadone, whatever? So I'm just going to have a look at this little video here, which seems to address that very thing, and we'll see. I'll give my twist on it then. This guy's the professional, and let's listen to him.
Initially producing a rush of euphoria and providing pain relief. Those effects are short-lived, however, and a tolerance to the drug soon develops, so people take it again and again, in greater and greater doses, hoping to find that same rush. With continued use, a heroin user can expect a host of health issues, including a high risk for hepatitis C and HIV, dental problems, chronic respiratory illness, sexual impotence, skin issues, and depression. Heroin use is also associated with higher risks of being incarcerated, being the victim of violent crime, and early death. But the powerfully addictive nature of heroin makes an addicted person carry on using the drug despite these effects and consequences.
Can't argue with that. Got 40 years behind me on that one, bro. So yeah, so far so good.
It's important to understand that this addiction becomes a medical condition by changing the wiring of the brain, but help is available. The first step is detoxification. This can mean completely stopping all opiates or taking decreasing dosages of long-acting prescriptions and reduce cravings. Medically supervised detox is more effective as well as less uncomfortable than going it alone. Doctors can prescribe medicines to help ease the discomfort associated with withdrawal from both heroin and other substances often taken by heroin users. This is usually done on an inpatient basis. Ongoing medical maintenance is a tried and true approach to staying off heroin.
Really?
Since the 1960s, countless people have found success through methadone, which activates opioid receptors in the brain but has a milder, longer-acting effect. This enables people to avoid withdrawal symptoms without heroin's many negative effects. Due to the potential for abuse, methadone is only available by daily visiting a specialized clinic.
We're going to stop this. We're going to stop this guy right here. We're going to stop this guy right here. Something he just said there, I totally disagree with. He was talking about the methadone has been successful in stopping. Like, this guy's a doctor, and he's learned his information from research and from books, and he's also promoting the pharmaceutical industry because that's what they do. Now, here's the thing. To say that the harmful effects of heroin, that methadone is better, that is so untrue. Heroin's made from a plant and it's organic. Methadone is a chemical. It's a synthesized chemical, and it's done to simulate the effects of heroin, but it's a chemical. And he's suggesting that it's much more healthier to be on this chemical than have some of these bad side effects from heroin. Well, let me tell you, clean heroin is a lot better for you than methadone, for your health, that is. You could come off years of heroin with 10 days of heavy withdrawals. You try that with methadone, you're looking at 6 weeks to 2 months. Now, I know what I'm talking about here, guys.
Newer medications that are formulated to reduce abuse potential are now available. These include suboxone, which not only reduces withdrawal symptoms, but also blocks the effects of injected opioids, and Vivitrol, which is given once a month by injection. It's non-addictive and non-sedating and blocks the effect of opioids, making heroin ineffective and unappealing. But medical therapies alone are rarely enough. The best approach includes behavioral treatment to address underlying emotional and psychological issues that may have led to heroin use in the first place, along with issues that have developed due to heroin use.
Now, guys, I just want to say the last two medications you mentioned there, suboxone and Vivitrol, I'm a big fan of suboxone for people coming off heroin as opposed to methadone. That's the route I went, and it's the way to go. It really is. Okay, guys, let's get this on.
A support system of recovering people, family, friends, and treatment professionals is also essential to a lasting, gratifying recovery. To learn more about heroin addiction treatment, visit the Information Center at...
All right, so the dude is plugging something. I didn't realize that until the end of this here. But, I thought it was just actual public information. But no, there seems to be an agenda here. So he wasn't the best guy to give us an honest portrait. But he did tell us what the options were. There's methadone and the suboxone. If you're looking for a medication to come off heroin without the withdrawals, methadone, suboxone. And I suggest suboxone is a much better medication than methadone. With suboxone, you have your clarity, you can think, and there's also a blocker, a heroin blocker in it. But it will also take away the painful withdrawals. So suboxone all the way. Methadone, it's just liquid handcuffs, as a good friend of mine said. I believe Joe Butler. He came up with that phrase back in the 90s. Joe's a friend of mine, Joe's 61, and yeah, he came up with that phrase, liquid handcuffs, back in the day, and that's kind of basically what methadone is. Yeah, so guys, look, stay safe and stay tuned for more information about detox and safe ways. And that guy talked about rewiring. That's something I'm really into, but that's something I go with the route, because the suggested way to rewire your brain is to do a 12-step program, and over a period of years that you will eventually rewire your brain. Addicts are more impatient, and once you get over the physical withdrawals, I think the best way to rewire your brain is with psychedelic treatment. And I say that because that's what I did, and that's what helped me, and it's helped countless friends of mine. This is Paul Tracy. This is KoldTurkey, signing out. Stay blessed. Thank you.